Once my patient has failed first and second line therapies, I generally have another discussion with them about third line therapies. My patients are really aware of third line therapies because I introduce third line therapies right at that very first visit. So when I get to the point where their medications aren't working, they've already heard about third line therapies from me, and I do offer every third line therapy. However, I do think sacral neuromodulation is the best option for most patients because you get a nice test drive. I explain it as sort of a nerve evaluation because we talk about that medications, behavioral therapies generally work on the muscles, and then if that doesn't work, then we have to really look and see, is there a nerve issue? And so I think sacral neuromodulation is a great option, the P&E, so that they can really have an evaluation. It's almost like a diagnostic tool. So when I'm discussing Botox versus sacral neuromodulation with a patient, I obviously do offer all options. However, I try to explain to them that sacral neuromodulation, they can do the P&E, they can test drive this treatment, and then if it doesn't work, they can certainly go for Botox or PTNS. But if you go for Botox first, you generally have to wait a little while before we can actually do sacral neuromodulation. So why not do the sacral neuromodulation P&E first, and then if that doesn't work for them, move on to Botox.